Hi, beautiful people. It's Monday, and this video is about coronavirus disease 2019 or COVID-19. Now, I know you've already heard a lot of information about COVID-19, but this video is me as an ER physician talking to you as an individual and as a community. So, for basics, we know COVID-19 usually causes fever, cough, and shortness of breath, and it's spread from person to person. We also know that other countries, China, Iran, most European countries, the United Kingdom, Ireland, South Korea, they're all dealing with the coronavirus as well. But yes, the United States is also dealing with the coronavirus, and yes, COVID-19 is here in South Florida. So we want you to stay healthy. Of course, we want you to stay healthy, and that means staying home. That means washing your hands with soap and water for 20 seconds at least, avoiding touching your face, and obviously, common sense, avoiding sick people. But to circle back about the whole avoiding sick people thing, people with COVID-19 range from no symptoms at all to obviously fever, cough, and shortness of breath and being critically ill. We know this, but to go back to that whole no symptoms to mild symptoms, this is why there is a recommendation for you to practice social distancing at this time. Some people are saying, well, what's the big deal? I want to go to the gym, I want to go to the mall, I want to do this and that. You're going to a place where you're potentially exposing yourself to someone who has COVID-19. They may not look sick. They may not be coughing when you see them. They may have coughed and touched the door handle or something that you then go and touch, and you touch your face without washing your hands. And now you're exposed, and now you go and expose your family members, your loved ones, your friends, whoever, and then they're doing the same thing. They're now exposed, but they're going to the gym, they're going to a restaurant, they're going to the mall, and now they're pretty much spreading and spreading and spreading, and eventually this turns into an exponential rate of spreading. What does that mean for our healthcare system? We as emergency departments, as hospitals, as urgent cares, as minute clinics, we do not have an infinite amount of resources. So by you as an individual or you as a community not taking this public health emergency seriously and continuing to go wherever you want to these public places that are not a necessity for you to be at, you are contributing to the exponential spread of the virus and of the disease, which means more people are going to get it, which means more people are going to be critically ill, which means more people are going to die. When a hospital or ER gets a surge of critically ill patients, we all know the resources are not infinite. Okay, we don't have an infinite amount of equipment such as ventilators, such as certain medications, such as simply put, rooms, beds. We don't have an infinite amount. And if we do get a surge of patients, and I'm not just speaking for my hospital, I'm speaking for hospitals anywhere, not just in the United States, we don't have an infinite amount of resources. And so by everyone not doing their part in order to reduce exposure to themselves, we are creating a bigger problem here in the United States, where resources are going to be exhausted and there are going to be unnecessary consequences from this that we could have potentially prevented. Now, if you are sick, if you're healthy and you have mild cough and fever, stay home. Call your primary care doctor for further instructions on what to do, on testing, things of that nature, or call a telemedicine provider for same, further instructions on what to do and how you can keep yourself safe going forward during this public health emergency. If you're someone who has a low immune system, you're immunocompromised, you have chronic lung disease, chronic kidney disease, you're diabetic, you're just a sickly person at baseline, even when you're not sick with something, you do need to call your primary care doctor for further instructions. And you have the potential to get sicker than someone who doesn't have baseline illness. So you may end up needing to go to the ER. Obviously, anyone, whether you're healthy or not healthy at baseline, if you're having fever, cough, and shortness of breath, you do need to go to the ER for further assistance and care. You'll need to be isolated for testing and admitted, obviously, if you're having shortness of breath. But I just want to have everyone keep in mind that everyone does not need to be in the ER. In fact, if you don't have any symptoms or if you don't have an emergency, you do not need to be in the ER. In fact, do not go to the ER. Do not risk putting yourself at exposure in any public place that you do not need to be at. If you do have any questions, please link them below. Continue to stay healthy, stay home, protect yourself and protect your loved ones. Hopefully this information helps someone, and I hope you do continue to be blessed and stay healthy.